Arthroscopic anterior elbow release. We're going to perform an arthroscopic release of this elbow to increase extension. This patient had trauma and cannot extend the elbow. We localize our portal with a spinal needle, then use a scalpel to cut through the joint capsule to make a rather large portal to facilitate the placement of instruments in the joint. The capsule is the balloon around the elbow and is preventing him from extending the elbow because it's thickened and scarred from the trauma. First, we're going to use a motorized shaver to clean up any debris and scarring from the trauma. Also to better define the tissues in the joint capsule so we can better see what we're going to cut. This is the cutter. We take this in steps. We first dissect outside the capsule. You can see moving on the outside of the capsule to separate it from the tissues above it, meaning the muscle and the nerves. And then when it's free and clear, then we simply bite out the capsule so that we can extend the joint. The capsule is what's keeping us from fully extending it. And just simply alternating steps. We dissect outside, as you can see me moving it outside, to separate it from the surrounding tissues, which now you can see the muscle in the background, and we're going to bite out the capsule. This will allow the elbow to extend. The arthroscopic release really does better with less pain and less problems than the open release. Sometimes you need to do an open release, but if you can do it arthroscopically, it's real nice. You can see the defect in the capsule that will now allow this patient to be able to extend the elbow. Now we use a motorized shaver again to clean up any debris out of the elbow and shave down the joint capsule a little bit more. You can see the nice defect there with the tissues behind all protected. All done.